Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about pyogenic liver abscess. If you see pyogenic liver abscess, it is the most common type of liver abscess which you see, and this is present in 5th to 6th decade, and exclusively it is present in alcoholic males. What is the most common organism in pyogenic liver abscess is E. coli, which is seen worldwide. The most common organism worldwide is E. coli, and in Asia the most common organism is Klebsiella is the most common organism which is associated with pyogenic liver abscess in Asia. And if you see most common organism associated with children who are suffering from chronic granulomatous disease, is staphylococcal aureus is the most common organism which is associated in children suffering from granulomatous disease. Now, if you see the route of infection, first and foremost we have biliary tract. The route of infection is either biliary tract or bile duct. So here that is common bile duct stones, or we have hilar cholangiocarcinoma. These includes common bile duct stones, hilar cholangiocarcinoma, or if there is common bile duct strictures. All these will predispose the patient to cholangitis. Once the cholangitis develops, this can lead to pyogenic liver abscess. Whenever there are these obstructions in these patients, if you see the clinical features, you will see presence of obstructive jaundice will be seen in these patients. Is seen in almost 25% of cases. And if you see most common LFT abnormality here is increased alkaline phosphatase. Then if you see the second problem here is portal vein. Portal vein is the second most common route. First most common route is through bile duct or biliary tract. And if you see second most common route is portal vein, where you will see presence of appendicular perforation is seen. Appendicular perforation or diverticulitis is seen. Appendicular perforation or diverticulitis. So this can increase the risk of pyogenic liver abscess. Then we have the third one. The third route of infection is involvement of hepatic artery, and this is involved in children who are actually suffering from, it is seen in children suffering from chronic granulomatous disease. It is seen in children suffering from chronic granulomatous disease. Here, if the children are suffering from chronic granulomatous disease, they will have defective neutrophil function. This defective neutrophil function will lead to increased risk of subacute bacterial endocarditis. It will lead to increased risk of subacute bacterial endocarditis. Thus, the infection will now reach the liver via hepatic artery. The infection will reach the liver via hepatic artery, thus resulting in pyogenic liver abscess. So this is about the route of infection, that is hepatic artery. Then if you see the fourth route of infection is, if there can be direct extension of infection can occur. There can occur direct extension of infection can occur either from pyothorax or subdiaphragmatic abscess or direct extension of infection occurs from acute suppurative cholangitis, and direct extension of the infection also occurs from perinephric abscess. So these are the different conditions from which direct extension of infection occurs. So if you see the clinical features of pyogenic liver abscess, the most common symptom of pyogenic liver abscess is fever with chills and rigors, and the patient also suffers from abdominal pain, anorexia and fatigue. Patient suffers from abdominal pain, anorexia, fatigue. Actually, fatigue is the most characteristic symptom. Here, in 20 to 25% of cases, the patient presents with jaundice. Then, lab parameters. Then, if you see lab parameters, any kind of obstruction to CVD, there will be increased ALP, increased GGT, that is gamma glutamyl transferase is increased, and 5-nucleotidase is increased. Among this increase in ALP is most common. Then how are you going to diagnose it? Diagnosis, the first investigation which is done is ultrasonography. But what is the investigation of choice is aspiration, and culture is the investigation of choice. Now how are you going to treat the pyogenic liver abscess? It is treated by percutaneous. It is treated by percutaneous drainage, that is percutaneous catheter drainage. It is treated by percutaneous catheter drainage and systemic antibiotics. So this is about the pyogenic liver abscess. Thank you for watching.
Thank you, and thank you for watching.